Hey guys, let's answer the top 5 most frequently asked questions by people that are looking to start treatment with us or have just started treatment with us. So question number 1, can you help the problem that I'm going through? More specifically, I think they're asking, have you ever seen this type of situation? And are you the right fit for me? And let me tell you exactly who we help. Our specialty is helping people to avoid surgery, get off of pain medications, and get back to being an active person, doing what you love, whether it's exercising or hanging out with the family or just being able to do your everyday chores and things that you do at home and at work without your problems slowing you down from doing them. Some of the most common problems that we see are lower back pain issues, neck problems, shoulder problems, elbow, wrist, and hand problems are something that we see frequently, hip issues and knee problems, and we also see people for foot problems. The 2 most common problems that we see are lower back issues, especially related to herniated discs and arthritis. And associated with that, we commonly see sciatica type issues as well. We help people in that situation all the time. Many times they've seen doctors that want to operate on the disc or the arthritis. They want to do fusions or they want to cut out the disc. And we frequently help people completely avoid surgery, get off of pain medications, and get back to doing what they want to do and manage their back so that the problem isn't coming back. Neck and shoulder problems are very similar. In the shoulder, we frequently see people that have torn rotator cuffs or bursitis is another common problem that we see in the shoulder, and that can be solved without surgery. Even if you have a rotator cuff tear, there's tremendous research, and we have clients that have done it themselves here in the clinic that have avoided having surgery altogether despite having a tear in their rotator cuff. And we see disc problems in the neck, pinched nerves that go down from the neck that go down into the shoulder and all the way down into the hand. Commonly that causes carpal tunnel type symptoms where they get numbness, tingling, or pain into the wrist, fingers, or even the back of the hand. Now down in the hip and knee, those 2 joints are commonly related. We frequently see pain in the front of the hip or the side of the hip. Bursitis is a common problem. Arthritis in the hip is frequently seen here. And in the knee, we frequently see meniscus problems, cartilage problems like behind the kneecap, the patella. And sometimes that is associated with nerve problems that are coming off the back that go into the hip and knee and even into the foot. Now, going into the foot, the most common foot issue that we see is plantar fasciitis. And 9 times out of 10, it's not even a root problem in the foot. We actually have to go up into the knee, hip, or even the back to address the plantar fasciitis correctly. So those are the types of issues that we see, and our focus is constantly, how can we avoid surgery? If you've already had surgery, how can we avoid the next surgery? Or how can we avoid surgery altogether if you never had it? We want to make sure that no scalpel touches your skin ever. And then how can we save your organs from the side effects of all the medications that you might be taking to dull the pain or numb the problem so that you can just get through the day? And the most important thing is can we help you get back to sleeping through the whole night without this problem and being able to walk, exercise, be with your family, do all the fun things that you love to do in life without having to be slowed down by this issue that you're dealing with. So those are the types of problems that we see and the types of people that we're trying to help out. The ones that are looking to avoid surgery, avoid medications, and get back to being active. So here's the second most common question that we get in our clinic. What makes you guys different? And I'll tell you, the attention that we give to all our clients on every front is unparalleled. So if you ever call our clinic, you've probably called the clinic if you're watching this DVD. You probably had a great chat with our person that answers the phone, and it's going to continue all the way through. When you come in to see us, it's all one-on-one visits. We make sure to give you ample time to get all your questions answered because our focus is teaching you. It's not just doing the hands-on work and showing you the exercises, but it's making sure that you know, that you understand why your problem came on, why it's there, and what needs to happen so that you can make it better for the short term and the long term so that next month, 6 months from now, next year, a few years from now, this problem is still under your control, that you're managing it so that it's not something that's consuming your life and stopping you from doing what you want to do. And aside from that, of course, our expert level care, like I said, we're fellowship trained, and all our physical therapists are trained by me as well. So the level of hands-on skills are unmet by anyone else in the area as well. Question number 3 that we commonly get is, can I use my health insurance? And the answer is yes, we can provide you with all the paperwork necessary to submit to your health insurance so that you can use your health insurance benefits. Now, insurance coverage varies and it depends on your specific plan, your deductible, your copay. What we recommend is get your health insurance card out and look at the phone number on the back of the card, call that number and ask them specifically, what are my benefits for physical therapy? And they'll be able to give you all the details for your plan. That way you can have a good idea of what you would be paying for out of pocket and what's covered by the insurance company. For our clients that are choosing to pay out of pocket, we offer a variety of ways for them to pay so that it's affordable for everyone. You can also pay for our services using flexible spending accounts and health savings accounts. Question number 4, how long will my treatment take? This varies tremendously depending on your case. On average, our clients are seen for 6 to 8 visits per case. But understand, there are some cases that take 2 or 3 visits, and there's some cases that take 10, 12 or more visits. It just depends on how severe your problem is, how long it's been there, how much it's slowing you down, and what your specific goals are. But what is important to note here is that most other PT clinics will see you for double what we see our clients for. The average for most of the clinics in town is 12 visits or more. Like I said, ours are 6 to 8, and we have a heavy emphasis on teaching you what to do so that you can go outside of here and be able to continue your exercise plan, your healthcare plan on your own without having to rely on us for the long term. Question number 5, what happens during the treatments? And this is a great question, and it just depends on your specific situation, but generally there's a combination of hands-on techniques that are done for your specific problem. In the evaluation, the first full visit, we narrow down all the details of your problem so that we know where to intervene at the root of the problem, not just where the symptoms are. Because say, for example, in the case of a carpal tunnel type pain, you may be getting a lot of problems in your hand, but we may need to intervene at the shoulder or the neck, and so we do all the techniques up there in addition to the hand to make sure that your problem is taken care of. It's a similar situation in the foot. For plantar fasciitis, sometimes we need to go up into the knee and the hip and in the lower back, so while you're here for a foot problem, you may be getting treatment in your back, hip, or knee to address the foot problem, but that's how we can ensure that this goes as fast as possible. In addition to the hands-on techniques, we'll be showing you some exercises that are very doable by you. They're not going to be exercises that are beyond your ability, and you'll have to keep those up outside of here on a regular basis, which we'll discuss in person so that it meets your situation as far as your work and home and all the other things you got to fit in your life. This has to be doable for you to have the best success, so we make sure to discuss that. And the final piece that we'll throw in is any sort of modifications to your life. So it's not really an exercise or a hands-on technique, but we might need to talk about any adjustments to your workspace, the place that you like to sit at home, your car, your vehicle that you like to drive in may need some adjustments, your footwear, your clothing even. We've had some people that have to adjust their belts because of hip problems or back problems. So we'll discuss all those other variables that may not be as evident to you. You may not realize that they're influencing the problem, so that we can speed up this problem as fast as possible to recovery so that you can get back to doing what you love to do without this problem slowing you down and avoiding surgery and medications, of course. So guys, that rounds out the top 5 most commonly asked questions by new clients that are just starting out with us or looking to start with us. If you have any specific questions besides these, please reach out. We'll be happy to answer them. You can reach us at 915-503-1314.